Hey everyone, it's Michael here again, and welcome to another one of our videos. In this video series, we're talking about creating programs for your agency to be able to make yourself stand out. One of the most important things that you guys need to do, and the main topic for this particular video, is creating a pain management program. So this is one thing you definitely want to be able to add for your company, so let's go ahead and get started. So like I said, pain management program. You need to understand that pain is a significant public health concern, and as more than half of Americans live with like chronic or recurring pain, there's more Americans that suffer from pain than diabetes, heart disease, or even cancer combined. Two of the most common areas in which people experience pain are the lower back and also the knee. More than 42 million people report some form of pain, physical discomfort, or disruption of sleep. To make sure that pain is adequately addressed, pain management has been developed to actively pursue the source of pain and provide therapy to be able to improve the outcomes. The focus of a pain management program is guided by the history of the specific pain, its duration, its aggravating and relieving conditions, and the structures that are involved that's causing the pain. What causes the pain? We want to be able to figure that out and to be able to help the patient improve this particular pain. Patient management is pretty much a specific role to be able to identify the source of the pain and to be able to find out the most optimal treatment. That's our goal. When we work out there, when we promote our pain management program, we want to be able to talk about what are the common conditions or diagnosis that is treated or is assisted within your pain program. You want, your neck, back, shoulder pain, talk about acute or chronic pain, or let's say, for example, pain, like phantom pain where a patient has an amputation. They have the history of that. You want to be able to talk about post-surgical pain. What is your agency doing in regards to how to alleviate the pain, how to lessen, how to remove the possibility, and at the be able to do, and how they're going to be able to improve the outcome of the patients? Your physical therapy program. Are you guys doing neurological testing, body mechanics teaching, home safety evaluations? Are you giving, patient and caregiver education? Are your therapists providing strength and range of motion assessments? You want to be able to even talk about possible equipments that you can use to be able to alleviate the pain, other than just using medication, of course, or those pharmacological assistance. You want to be able to talk about other items that you can actually offer, right? This is a way to be able to introduce, for example, starting an E-stim program or a TENS program or an ultrasound or cold laser program. There's a variety of different products out there and services that you can add separately to promote your pain management program other than just medication. Remember, creating a pain management program is probably one of the most important things that you can create. All agencies will tell people that, yes, we help with the pain. Yes, we assess for pain. Yes, we provide therapy, right? Having that different scale, 0 to 10. All agencies will do this. But if you can actually specifically create a pain management program and actually detail the step-by-step measures that your agency is going to do to be able to take care of the patient, of that physician, that makes you guys different. You can even challenge them. You can say, hey, doctor, can you honestly tell me right now what the procedures are by the other agencies that you're currently referring your patients to so that they can manage the pain of your patients? I can guarantee you that 1 out of 100 can only do this. Not all agencies have these E-stems, has those ultrasound care, has all these other things that we're using other than pain management. So by us challenging these physicians, they're going to start thinking, well, you know what? That agency just say they manage the pain, but they never really told me that they have all these additional, services, these additional therapies, these optional therapies compared to just using pain management and range of motion stuff and basic therapy, right? I can guarantee you, let me ask this question. If you're a home health agency right now, do you guys offer an E-stim program? Do you guys use, do you guys have that in your repertoire? Do you guys have that with your therapy services? Do you guys have, pretty much sometimes, we even have brought in aromatherapy, for example. That's another optional, that is an osteopathic thing that you can use in addition to the pain management. So there are a variety of different things that you guys need to start thinking and looking and to add into your system, into your programs. You need to be able to create these profiles, these program pamphlets, and then share that with the physician. Other than your brochure that shows your skilled nursing, physical therapy, occupational therapy, MSW, social workers, those kind of services, those are just the basic for home health agencies. But do you have this other option on your pain management? Are you guys adding more stuff that's going to make yourself stand out? That's the ultimate goal here in creating these programs. So yes, I know if you're a home health agency, you guys manage the pain, but start thinking on how you can actually make your pain management program pretty much above the rest, making yourself stand out from the competition. Now, if you guys like this video, make sure you comment down below. If you have any questions, always notify us, contact us. That's the main goal here at this company. Always understand that home health marketing is easy when you know what you're doing. So don't forget to click subscribe. Don't forget to click the bell icon to be notified of any new videos that are coming out. This is Michael signing out. Have a great day.